If you follow me on LinkedIn, I made a post about a health organization who lost $40,000 within a couple months from one of their largest donors because they were doing the same old thing and thought that they would continue to get away with it. But these organizations are funding programs and initiatives that are intentional. These funders are not just people who's, hey, I like Brittany, I'm gonna keep giving her this money. There's a team of people who make a decision on why Brittany should get this money, why this health program should get this money. And when you're not convincing those people who are in charge of saying yes or no to your proposal for your program, for your organization, even if are serving communities that are in desperate need, a lot of the times that is the reason why you get no, because you're doing status quo things, you're playing safe, you're not innovating, you're not connecting with other partners, you're not intentionally reaching the communities that you aim to serve. And when you create a persona, a detailed profile of the intended audience that you aim to reach, things will change for the best for you. Organizations are going to all these different types of events, conventions, and conferences that have nothing to do with their program. And even if it does have something to do with their program, they're not optimizing that opportunity to build relationships, to educate, to build trust. I love going to health events just to see what's missing, the setup. When you get into it and you understand how organizations can be extremely profitable in different ways when they do outreach and they're reaching their intended audience, they will do so much better. One of the things about the development of a persona, a detailed profile of the person or group of people that you're aiming to reach, is that there's some pros and cons. There's truly pros and cons. The importance of the persona is it helps organizations and staff design and deploy effective programs, outreach, and marketing strategies that align with the intended audiences that will benefit from their resources. That's why you need a persona. Anytime you create a new program that isn't already reaching that existing audience. And sometimes, even if it's a new program reaching the same audience, there's going to be differences between the person's needs for this new program. So it just depends. But a lot of times, if there's no persona for that specific type of program, you need to create one. You want your staff, you want community partners, volunteer, be aware of exactly who we're trying to reach and why. We want them to understand the persona, the type of person or group of people we're aiming to serve with our program. So there's no waste of funds. There's no waste of time and resources. Everything is running smoothly and we're reaching the people that we aim to serve. And so then we're feeling fulfilled in our work because there's clarity into those we're reaching. And then there's that trust factor that's being rebuilt and established. Building a persona ensures alignment across your entire team. It builds trust and rapport with the community, which I love, and it really works. I've been in healthcare and public health for over 15 years. I've been a consultant for 8. And when organizations have a persona, it really kills the stress among the team, like truly. And then they're able to do their work more effectively. Effective use of time, money, and resources increases recruitment and retention rates in your programs. That's the money waster or the money maker. A lot of nonprofits think they're not businesses, but nonprofits are businesses. They need money to operate. What's going to help you operate is reaching the goals of your health program that you've established. And if you don't know exactly who you're supposed to be reaching for these programs, that's probably why your recruitment rates are low. Or if your recruitment rates are high, your retention rates, how long someone's staying in your program, is probably low. If your retention rates are high, your recruitment rates are high, maybe your outcomes of your programs are lower than what you would like. So finding where that gap is and identifying the leak and fixing it. And so we do help organizations assess their existing programs, partnerships, and community outreach initiatives so that they can identify the leak and be more successful and sustainable long term. A persona also improves access to resources and health outcomes. When you know exactly who you're serving, you can talk to the right person and get them the help that they need or the resource that they need so that they can have a better life or better mental health. Public health isn't just about improving the health of someone physically, but if someone can feel that stress because now they know exactly where to go to get their child's vaccination records. They didn't know this was a resource offered in their community. When I lived in Nashville, Tennessee, I had no clue that a midwife was in my community free of charge. You know how less stressed I was? I felt like I was surrounded by angels. Even if I chose not to use that service, I knew that was an option for me. So now that I know that resource is available, I feel a level of stress that has been released from myself, and I can tell my friends about it who might be pregnant in the future. But there are risks with creating a persona for your program or your initiative. Unintentional biases can happen when you're creating your own persona. That's why it should take a team effort and it should be tested. See if you're reaching the right person and why the right person wasn't reached. We evaluate our efforts in everything we do. At least that's what you're supposed to be doing. But personas is at risk of biases, stereotype, improper research. I love AI. I really do. I love ChatGPT and Google Gemini, all these other programs out there. But sometimes if you're putting in the wrong things, it gives you the wrong information. Google Gemini is a lot more credible than ChatGPT because they actually list sources with what they're generating if you ask for it. And so me, as someone who's done research for decades in my life and career, I know proper research, those certain measures to look for to qualify something as proper research. But you still have to be very careful because despite what we research, we also have to make sure when we're engaging with our community that it's not unintentionally offensive. The thing about a persona is that people's needs are evolving, right? Maybe they got the resource for improving their health as a mother who's going to be birthing a baby soon, and now they need the proper bedding or safe sleep to make sure that there's no incidents, right? So there are all needs when you're creating a persona, but doing so will change the game for your health program or your initiative. Even if you're an organization who has this annual summit, maybe you've been doing one and the participation rates are low, that's probably when you need to create a persona and say, these are exactly the type of people we want. These are the type of vendors we want, and having a why. One of the best exercises that I encourage organizations to do when I'm facilitating strategic planning, I have them do a 5 whys conversation. First of all, you figure out the ultimate goal. So the ultimate goal is to have a health summit that improves access to resources for our community. That's the ultimate goal. But why are we doing? You ask yourself why 5 times that align with the goal. It's a great exercise when there's conflict among ideas on a team, whether it's your staff, your coalition, your board, whoever that group of people are. It's a great exercise to get clarity. If you want to create your own persona for your health organization, or even if you're a business owner, HubSpot has a great tool. It is free, and you put in all those parameters, and then it will give you your ideal persona. Some call it a buyer's persona, client persona, patient persona. I don't think that word is really widely used in the healthcare and public health space. That's probably why they're not hitting certain goals that they want to achieve for their programs, because they don't have clarity on the first and most important aspect of what they're doing in their organization, and that's who they're serving. Please drop the word impact if you are a health organization who wants to go deeper. If you have any questions, let me know. Have a great day.